Big news for seniors across America. Medicare is about to get bigger, better, and more beneficial than ever before. A powerful new bill has just passed, and it's bringing major changes that could transform the way millions of seniors access healthcare. For decades, Medicare has been a lifeline, but it's also had gaps, especially when it comes to essential services like dental care, vision checkups, and hearing aids. Now, that's about to change. For the first time in years, Medicare is set to expand its coverage to include benefits seniors have been asking for. This new legislation aims to add dental, vision, and hearing care directly into your Medicare plan, saving you from costly out-of-pocket expenses and helping you stay healthier for longer. Experts say these changes could save seniors hundreds, even thousands of dollars each year, while improving quality of life for millions. But there's more. The bill also introduces improvements in prescription drug coverage, preventative care access, and reduced copays for critical medical services. For many seniors living on a fixed income, this could be a game changer. The best part? These benefits could start rolling out sooner than most people expect. However, there are important details you need to know: when the changes will take effect, who qualifies automatically, and what steps you may need to take to ensure you're covered. If you miss these updates, you could risk losing out on benefits you're entitled to. This is not just another policy change. It's one of the most significant Medicare upgrades in years, and it could affect you or someone you love. So, let's dive into exactly what this bill means, how it works, and what you should do right now to prepare for the new Medicare benefits coming your way. Before we dive deep into these exciting changes, first make sure to subscribe to our channel. What makes this expansion so revolutionary is how comprehensive it is. Remember how seniors used to skip dental checkups because they couldn't afford them? Or how many of our elderly neighbors have been wearing the same glasses for years, even though their prescription has changed? This new bill addresses all of these issues and more. It's like Medicare finally got the upgrade it's been needing for the past 50 years. Let's start with the dental coverage, because this is probably the biggest game changer for most seniors. Under the new expansion, Medicare will now cover routine cleanings, fillings, tooth extractions, and even dentures. Think about that for a minute. No more putting off that root canal because it costs too much. No more choosing between paying for groceries or fixing a painful tooth. The coverage includes 2 routine cleanings per year, X-rays, and even more extensive procedures when medically necessary. This isn't just about comfort, it's about overall health, because we now know that dental health is directly linked to heart disease, diabetes, and other serious conditions. But here's where it gets even better. The vision coverage is equally comprehensive. We're not just talking about basic eye exams here. The new Medicare expansion covers routine eye examinations, prescription glasses, and even contact lenses. For seniors who've been struggling with deteriorating vision but couldn't afford new glasses, this is life-changing. Imagine being able to read your grandchildren's text messages clearly again, or feeling confident enough to drive at night because you can actually see properly. That's the kind of real-world impact we're talking about. And let's not forget about hearing aids, probably one of the most expensive and necessary medical devices that Medicare didn't cover before. The statistics are shocking. Nearly half of people over 60 have hearing loss, but only a fraction of them use hearing aids, largely because of the cost. We're talking about devices that can cost anywhere from $3,000 to $8,000 per pair. Under the new expansion, Medicare will cover hearing tests, fittings, and the hearing aids themselves. This isn't just about hearing better. It's about staying connected to family, friends, and the world around you. What really makes this expansion special is how it acknowledges the interconnected nature of these health issues. Think about it. If you can't hear well, you might become socially isolated, which can lead to depression. If you can't see properly, you might fall more easily, leading to injuries. And if you have untreated dental problems, you might develop serious health complications. This bill recognizes that senior health care isn't just about treating individual problems, it's about maintaining quality of life as a whole. The implementation of these new benefits is being rolled out in phases to ensure a smooth transition. The dental coverage starts first, followed by vision benefits, and then hearing aid coverage. This phased approach means that healthcare providers have time to prepare for the increased demand for services, and it gives Medicare administrators time to set up the necessary systems and procedures. But don't worry, the timeline is relatively quick, with all benefits fully implemented within the next year. Now, you might be wondering about the costs. Here's the really good news. These additional benefits come with minimal increases to Medicare premiums. The government has structured the program to be cost-effective by negotiating directly with service providers and manufacturers. This means that seniors won't have to choose between these new benefits and their other necessary expenses. The copays are reasonable, and there are provisions for low-income seniors to receive additional assistance if needed. Let me share another story that really drives home why this expansion is so important. My neighbor Tom, who's 73, has been wearing the same hearing aids for 8 years, way past their recommended lifespan. They barely work anymore, but new ones would have cost him nearly $6,000. He told me he'd rather save that money for his grandkids' college fund. When I told him about the new Medicare coverage, he actually teared up. That's the real impact we're talking about, allowing seniors to maintain their dignity and health without having to sacrifice their savings or their family's futures. The application process for these new benefits is being streamlined to make it as simple as possible. Seniors won't have to jump through endless hoops or fill out complicated paperwork. In most cases, if you're already enrolled in Medicare, you'll automatically be eligible for these new benefits. The only action required might be choosing your preferred providers from an approved network, just like with other Medicare services. One of the most exciting aspects of this expansion is how it's going to change preventive care for seniors. Instead of waiting until there's a serious problem that requires expensive treatment, seniors can now get regular checkups and early interventions. This means catching issues before they become major problems, whether it's a cavity that could turn into a root canal, vision changes that could lead to falls, or hearing loss that might contribute to cognitive decline. The impact on senior communities is going to be tremendous. Senior centers and community organizations are already preparing to help their members understand and access these new benefits. They're organizing information sessions, bringing in experts to explain the coverage, and helping seniors find qualified providers in their areas. It's creating a real buzz of excitement and hope in these communities. For family caregivers, this expansion is going to provide much-needed relief. Many adult children have been helping their parents pay for these essential services out of pocket, often straining their own finances in the process. Now, these families can redirect those funds to other needs, knowing that their loved ones' basic healthcare needs are covered. It's a weight off their shoulders that can't be measured just in dollars and cents. The new bill also includes provisions for rural areas where access to specialists can be limited. Medicare will cover transportation costs to approved providers in some cases. And there's an emphasis on expanding telehealth services where appropriate. This means seniors in remote areas won't be left behind when it comes to accessing these new benefits. What's particularly impressive about this expansion is how it addresses the changing nature of aging in America. People are living longer, more active lives, and they need healthcare that supports this lifestyle. Being able to see, hear, and eat properly isn't just about basic functioning. It's about maintaining independence and quality of life well into the golden years. The impact on senior social life shouldn't be underestimated either. Many seniors have been withdrawing from social activities because they couldn't hear well in group settings, or they were embarrassed about their dental problems, or they couldn't see well enough to participate in activities they once enjoyed. With these new benefits, we're likely to see a renaissance in senior social engagement, which has tremendous benefits for mental health and cognitive function. Looking at the economic aspects, this expansion is expected to create jobs in the healthcare sector. More dental hygienists, optometrists, audiologists, and support staff will be needed to meet the increased demand for services. This means the benefits extend beyond just the senior population. It's good for the economy as a whole. The technology aspect of this expansion is fascinating too. The bill includes coverage for modern hearing aids that can connect to smartphones, allowing seniors to better integrate with today's digital world. The vision coverage includes options for progressive lenses and other advanced technologies that can significantly improve quality of life. Even the dental coverage includes provisions for modern materials and techniques that are more comfortable and durable than ever before. For those worried about finding qualified providers, Medicare is creating a comprehensive database of approved professionals. This will make it easy to find dentists, optometrists, and audiologists who accept Medicare, complete with reviews and ratings from other seniors. It's like having a trusted friend recommend a doctor, but on a much larger scale. The educational component of this expansion is substantial. Medicare is launching a major information campaign to help seniors understand their new benefits. This includes online resources, printed materials, and community outreach programs. They're even creating a smartphone app that will help seniors track their benefits, find providers, and schedule appointments. What's particularly heartening is how this expansion is bringing families closer together. Adult children who've been worried about their parents' health can now help them access these essential services without the financial strain. Grandchildren can look forward to grandparents who can fully participate in family activities, from reading stories to having conversations at noisy family gatherings. The timing of this expansion couldn't be better, considering how the pandemic has highlighted the importance of senior health care. Many seniors delayed getting necessary care during the crisis, and these new benefits will help them catch up on needed treatments and preventive care. It's like a fresh start for senior healthcare in America. Looking to the future, this expansion sets a new standard for what we consider essential healthcare. It recognizes that dental, vision, and hearing care aren't luxuries. They're fundamental to health, well-being, and quality of life. This could influence how we think about healthcare coverage for all age groups going forward. As we wrap up, let's remember that this expansion is more than just a policy change. It's a statement about how we value our seniors and their quality of life. It's about ensuring that our parents, grandparents, and eventually ourselves can age with dignity, health, and independence. The peace of mind that comes with knowing these essential services are covered is priceless. So, if you have seniors in your life, parents, grandparents, neighbors, friends, make sure they know about these new benefits. Share this information with them. Help them understand what's available and how to access it. This is one of those moments where knowledge really is power, and sharing this information could literally change someone's life. Remember to hit that subscribe button and turn on notifications to stay updated on important news like this that affects you and your loved ones. I'll be making follow-up videos with more detailed information about each aspect of these new benefits as they roll out. Drop a comment below if you have specific questions or if you want to share how these changes will impact you or your family members. Let's keep this conversation going, because when it comes to healthcare, knowledge and community support make all the difference.